I've voted on a lot of things in the House and in the Senate. I don't think I've voted on anything more important than the Affordable Care Act when it comes to domestic policy. Voting on war is something you never forget. But when it came to the Affordable Care Act, it was finally a chance to give to people across the United States a better chance to have health insurance. To me, health insurance is not a privilege, it is a right. And what we have to do in our government is find a way to make sure that it's accessible to everyone, regardless of their income in this country. Increasing by millions the number of people who finally had the peace of mind of having some form of health insurance. Some of them were Medicaid, some of them were already in the veterans systems, some of them were Medicare. No option, a public option. We ought to take a program like Medicare, which is popular and effective for 50 or 60 million Americans, and offer a form of Medicare as one of the options if you wish to take it in one of the insurance exchanges. If you're in the individual market shopping for insurance, premiums can get out of hand. Why? Because the people who are in that market, by and large, many of them are sick people who have chronic conditions. And they're rushing to buy this insurance, and if you're not one of those people, you're paying a higher premium because that risk pool isn't as large as it should be. So we need to improve that. So that's no bargain. And a lot of people are pushing back on that too. I'm joining in that. I think, and I'll talk about this a little more as we get into this, I think this whole area of behavioral health, mental illness, and addiction is one that is dramatically underserved in America and in our state. We need to provide more services for people who are struggling with these problems.